Hello and welcome. Read the following message and then press the button below to continue.
Introduction to phlebotomy safety. Phlebotomy is a critical intersection where medical science meets patient care, demanding precision, expertise, and an unwavering commitment to safety. This vital healthcare discipline involves a single misplaced needle, a mislabeled vial, or a lapse in sterile technique can trigger a cascade of adverse events. These can range from inaccurate diagnoses and compromised treatment plans to patient discomfort, infections, and even legal repercussions. Recognizing and mitigating this course offers a pathway to understanding safety applicable for both patients and clinical laboratory practices. It delves into established protocols and innovative strategies designed to minimize risks, optimize outcomes, and foster a culture of safety that permeates every aspect of phlebotomy. Evolution of patient safety standards. Patient safety in phlebotomy has evolved significantly, shaped by lessons learned, technological progress, and a growing understanding of patient protection. In the early days of medicine, procedures were often performed without a full understanding of infection control or potential harm. For instance, before the late 19th century, the 19th century saw pioneers like Florence Nightingale emphasize hygiene and sanitation in patient care. Her work during the Crimean War dramatically improved patient outcomes by highlighting the importance of a clean environment and proper nursing care. These foundational efforts key moments in phlebotomy safety. Phlebotomy has its own history of safety improvements, moving from basic practices with reusable equipment to sophisticated protocols. The late 19th and early 20th centuries introduced aseptic techniques in surgery, which greatly reduced infections. The mid-20th century marked a turning point with the introduction of disposable needles and blood collection tubes. This innovation significantly reduced the risk of transmitting diseases like hepatitis and HIV, which were major concerns with reused equipment. In the late 20th and early 21st centuries, concerns about needle stick injuries among healthcare workers led to the development of safety-engineered devices. These include needles with retractable shields and blood collection systems designed to minimize exposure to blood, dramatically reducing the 600,000 to 800,000 needle stick injuries estimated to occur annually. Barcoding and electronic tracking technology have made it easier to track specimens from collection to testing. This helps prevent mix-ups and ensures that the right results are matched with the right patient, reducing the potential for patient identification errors, which historically accounted for a significant percentage of laboratory errors. Electronic health records, EHRs, further centralize patient information. Point-of-care testing, POS devices allow healthcare professionals to perform certain tests at the patient's bedside, reducing the need to transport specimens to the lab. This speeds up diagnosis and treatment and reduces the risk of errors associated with specimen transport and handling. For example, regulatory bodies and continuous improvement are crucial for maintaining safety in phlebotomy. These elements ensure best practices and a culture of safety. Regulatory bodies like the Centers for Disease Control and Prevention, CDC, play a key role in setting and enforcing safety standards in phlebotomy. The CDC provides comprehensive guidelines on infection control practices, including hand hygiene and the use of personal protective equipment. These guidelines are widely adopted by healthcare facilities to ensure best practices for patient and worker safety. For example, the CDC's 5 Moments for Hand Hygiene are a globally recognized framework for when healthcare workers should clean their hands. The Occupational Safety and Health Administration, OSHA, also plays a key role. OSHA's bloodborne pathogens standard, for instance, mandates employers provide training, personal protective equipment, PPE, and engineering controls to protect healthcare workers from exposure to bloodborne pathogens. This standard has significantly reduced occupational exposures since its implementation. Patient safety is not a destination, but a continuous journey. As medical knowledge and technology advance, new opportunities to improve safety in phlebotomy constantly emerge. Ongoing monitoring, evaluation, and improvement are essential to ensure patients receive the safest possible care, fostering a culture where safety is a deeply ingrained value rather than just a checklist item. Risk assessment in blood collection. Risk assessment in blood collection is vital for ensuring patient safety and minimizing harm. It involves looking closely at each step of the phlebotomy process to spot what could go wrong and how to prevent it. The process begins by pinpointing specific risks patients face during blood draws, ranging from minor issues like bruising to more serious complications such as infections or nerve damage. Understanding these potential adverse events is the first step toward developing effective preventative strategies. For example, identifying patient safety risks. Infection is a significant concern whenever the skin is punctured, as bacteria can enter the bloodstream, leading to local or systemic infections like sepsis. Factors increasing infection risk include inadequate skin disinfection, non-sterile equipment, and poor hand hygiene. Studies show excessive bleeding, especially in patients on blood thinners or with bleeding disorders, can lead to discomfort, anxiety, and the need for additional medical intervention. Hematoma formation, where blood leaks under the skin, can occur if the vein is punctured through or if inadequate pressure is applied after the draw. Fainting, vasovagal syncope, can occur due to a sudden drop in blood pressure and heart rate, triggered by anxiety, pain, or the sight of blood. Nerve damage, though rare, can cause pain, tingling, or numbness if a nerve is accidentally punctured. Patient misidentification, a critical error. Systematic risk evaluation methodologies. To effectively evaluate risks, healthcare facilities should use systematic methodologies. Failure mode and effects analysis, FMEA, is a proactive method for identifying and evaluating potential failures in a process. In phlebotomy, FMEA involves listing each step of the blood draw, identifying potential failure Root cause analysis, RCA, is a reactive method used to investigate adverse events and identify underlying causes. When an incident occurs, such as a patient misidentification or needle stick injury, RCA helps determine what happened, why it happened, and what steps can prevent similar incidents. For example, checklists ensure all necessary steps are followed during phlebotomy, from verifying patient identity to applying pressure after the draw. Incident reporting systems allow staff to report errors, near misses, and adverse events, providing valuable data for risk assessment and quality improvement. A risk assessment matrix visually prioritizes risks based on preventative strategies for identified risks. Once risks are evaluated, preventative strategies are implemented to minimize adverse events. For infection prevention, strict hand hygiene before and after each patient encounter, using soap and water or alcohol-based hand sanitizer is crucial. Thorough skin disinfection with appropriate antiseptic solutions like chlorhexidine or povidone iodine before venipuncture is also essential. Always use sterile to prevent excessive bleeding and hematoma formation. Healthcare workers must assess a patient's bleeding risk, e.g., medications like anticoagulants, before a blood draw. Applying firm pressure to the puncture site for several minutes after the draw is critical, and for high-risk patients, topical hemostatic agents can promote clot formation. Proper venipuncture technique, avoiding fragile veins. To manage fainting, vasovagal syncope, position patients lying down or reclined. Address anxiety with clear explanations, and observe for signs like pallor or dizziness. For nerve damage, a thorough understanding of arm and hand anatomy is vital, along with gentle technique to avoid probing. Patient misidentification is prevented by using two patient identifiers, name, date of birth, medical record number, and barcode scanning, ensuring active patient participation. Proactive risk management. Proactive risk management is essential for maintaining patient safety in phlebotomy, focusing on preventing incidents rather than merely reacting to them. This involves regular training and education for healthcare workers on proper phlebotomy techniques, infection control practices, and risk management. Regular competency assessments ensure healthcare workers are proficient in performing blood draws and following safety protocols. Audits and inspections of phlebotomy areas help identify potential hazards and ensure compliance with safety standards. For example, fostering a culture of safety is paramount, where healthcare workers feel empowered to provide feedback on safety procedures and report any concerns or near misses without fear of blame. This open communication, combined with continuous improvement initiatives based on incident reports and feedback, creates a patient communication fundamentals. Clear and empathetic communication with patients is a cornerstone of safe and smooth blood draws. It extends beyond simply explaining the procedure. It's about building trust, easing worries, and ensuring patients feel respected and understood. Effective communication can significantly. Clear instructions also help patients prepare properly, such as advising them to drink water beforehand to make veins easier to find. Open communication encourages patients to share concerns or conditions, like being on blood thinners or having a history of fainting, enabling phlebotomists to take necessary precautions. Studies show that good patient-provider communication can to talk effectively, always introduce yourself and your role to personalize the interaction. Use simple language to explain the procedure, avoiding medical jargon. For example, say, "I'm going to draw some blood from your arm," instead of venipuncture. Actively listen. Informed consent and anxiety management. Before any blood draw, obtaining the patient's informed consent is a non-negotiable step. This means the patient must fully understand what will be done, why it's necessary, and the associated risks and benefits. It's not merely a formality, but a vital step in respecting patient autonomy and building trust. Documenting consent, usually through a signed form, serves as many patients experience anxiety related to blood draws, which can heighten pain perception and distress, sometimes leading to panic attacks or vasovagal syncope. Creating a calm, quiet, and private environment can significantly help. Encouraging relaxation techniques such as deep breathing or offering distraction techniques like listening to music or watching a video. It's crucial to show empathy by acknowledging that anxiety about blood draws is normal and letting patients know you understand their feelings. Treating each patient with respect and kindness and being patient if they are nervous fosters a supportive atmosphere. In some cases, topical anesthetics like psychological aspects of safety. Drawing blood is not just a physical act. It's deeply affected by a patient's state of mind. Emotions like fear and anxiety, past experiences, and cultural background all play a significant role in how smoothly and safely the procedure goes. For instance, fear of needles, trypanophoria. Anxious patients may tense up, making veins harder to find, or move suddenly, increasing the risk of injury. Extreme anxiety can even lead to fainting. A person's past medical experiences, whether positive or negative, significantly shape their current feelings. A difficult or painful blood draw can Creating a calm and supportive environment is key to reducing patient stress. Clear, simple communication, answering questions, and reassuring patients minimize discomfort. Distraction techniques, like chatting about unrelated topics or offering TV music, can divert attention. Legal and ethical safety considerations. Navigating phlebotomy involves a strong understanding of legal and ethical rules that protect patients and guide healthcare workers. At the heart of patient safety is the recognition of fundamental patient rights, ensuring individuals are treated with respect, dignity, and control over their healthcare decisions. This includes the right to informed consent requires providing clear, understandable information about the procedure, risks, benefits, and alternatives before a blood draw. Patients must be able to make informed decisions and have the right to refuse treatment, which must be Patients also have the right to privacy and confidentiality regarding their medical information, protected by laws like HIPAA in the United States. Healthcare practitioners have a legal duty of care to provide competent and reasonable care, adhering to accepted standards of practice. Failure to meet this duty can result in legal liability for negligence or malpractice. Hand hygiene fundamentals. Hand hygiene is the cornerstone of infection prevention in healthcare, especially vital in phlebotomy, where direct interaction with patients and blood samples occurs. Effective hand washing is a detailed process, not just a quick scrub, designed to remove germs and prevent their spread. The World Health Organization, WHO, identifies 5 key moments for hand hygiene in healthcare. Before touch, proper hand washing involves wetting hands with clean, running water, applying enough soap to cover all surfaces, and lathering thoroughly, ensuring to scrub for at least 20 seconds. This duration is crucial for mechanical removal of transient microorganisms. Rinsing well under running water and drying with a clean paper towel, then using the towel to turn off the faucet, prevents recontamination. Frequent hand washing can dry skin. Alcohol-based hand rubs, ABHRs, are an effective alternative when hands are not visibly soiled, especially when soap and water are unavailable. They come in gels, foams, or liquids, with alcohol concentrations between 60% and 95%. ABHRs are quick, easy to use, and more effective at killing bacteria and some viruses than soap and water, and are less drying. However, they are not effective against all germs. PPE protocols. Gloves, personal protective equipment, PPE, is crucial for staying safe in phlebotomy, protecting both healthcare workers and patients from exposure to infectious agents. Gloves are the most common type of PPE, acting as a barrier to keep germs away from hands and prevent infection spread. However, 3 main types of gloves are used: latex, nitrile, and vinyl. Latex gloves, once standard, are comfortable and flexible, but can cause allergic reactions in many individuals. Nitrile gloves, made from synthetic rubber, are an excellent latex-free alternative, offering good protection against punctures and chemicals. Vinyl gloves are less durable and best suited for low-risk tasks where high protection isn't critical. Nitrile. Proper donning and doffing of gloves are as important as selection to avoid contamination. Before donning, hands must be washed and gloves inspected for tears. When removing, grasp the outside of one glove near the wrist, peel it off inside out, and hold it in the gloved hand. Then, slide ungloved fingers under the cuff of the remaining glove. Peel it off inside out, trapping the first glove inside. Dispose of used gloves in a designated waste container and wash hands immediately. Other essential PPE. Beyond gloves, other types of PPE are essential in phlebotomy to protect against various hazards. Face shields and masks protect the face, nose, and mouth from splashes or sprays of blood or other body fluids. Surgical masks are suitable for routine procedures, preventing the spread of respiratory droplets. N95 respirators offer a higher level of protection. Protective eyewear, such as goggles or safety glasses, shields the eyes from splashes and sprays of blood or body fluids. This is crucial because blood-borne pathogens can enter the body through the mucous membranes of the eyes. Face shields provide full face protection and are often used. Gowns provide a barrier between clothing and potential contamination. particularly useful when large splashes or spills are likely. Disposable gowns are fluid resistant and designed for single use, offering convenience and preventing infection spread. Reusable gowns, made of washable fabric, can be used multiple times, but require proper laundering and disinfection between uses. Shoe covers. Aseptic technique is a critical mindset for patient safety. It focuses on maintaining a germ-free environment during blood collection to prevent healthcare-associated infection. Aseptic technique is more than just a procedure, it's a mindset focused on patient safety by maintaining a germ-free environment during blood collection. The core principles include sterilization, killing all microorganisms, disinfection, reducing microorganisms to a safe level, barrier methods, using gloves, masks, drapes, and proper handling to prevent contamination of sterile items. This approach is critical to prevent healthcare-associated infections, HAIs, which affect millions of patients annually worldwide. Sterilization methods for equipment are crucial, especially for items in direct contact with patient blood or skin. Autoclaving uses high-pressure steam to kill microorganisms, ideal for heat-resistant tools like stainless steel instruments. Chemical sterilization, using strong chemicals like glutaraldehyde, is suitable for heat-sensitive items but requires thorough rinsing. Ethylene oxide gas sterilization is another option for heat-sensitive equipment, though it's a longer process requiring specialized equipment. Irradiation uses radiation to kill microorganisms, often used for prepackaged disposable items like needles and syringes. Contamination prevention strategies are vital even with sterilized equipment. Thorough hand hygiene, using sterile, unexpired equipment, and proper skin preparation with antiseptics are essential. The no-touch technique prevents contamination by avoiding contact with parts of equipment entering the patient's body. Using sterile drapes creates a sterile field, and careful specimen handling, including tightly closing tubes without touching stoppers, prevents contamination after collection. Environmental control in collection. The environment where blood is drawn significantly impacts contamination risk, making environmental control crucial. Regular cleaning and disinfection of surfaces in the blood collection area, including countertops, chairs, and equipment, are essential. This routine cleaning helps remove pathogens that could Maintaining clean and well-ventilated air quality is important, with air filters used to remove dust and other particles if possible. Traffic control. Limiting the number of people entering the blood collection area reduces the risk of introducing contaminants. Proper waste disposal. Using designated sharps containers. Proper storage of sterile supplies in a clean, dry place, protected from dust and moisture, maintains their sterility. Case studies highlight the importance of these practices. A successful aseptic technique involves thorough hand washing, sterile equipment, and careful skin disinfection, resulting in no infection and a perfect sample. Conversely, failed aseptic technique, such as improper hand washing or touching the needle hub. Standard precaution implementation. Standard precautions are a set of infection control practices used to prevent disease transmission by treating all blood, body fluids, secretions, excretions, except sweat, non-intact skin, and mucous membranes as potentially infectious. This universal approach protects both healthcare workers. Key elements of standard precautions include rigorous hand hygiene, using personal protective equipment, PPE, like gloves, masks, eye protection, and gowns, and practicing respiratory hygiene, cough etiquette by covering coughs and sneezes. Safe injection practices, such as using new sterile needles and syringes for each injection, are paramount. Standard precautions are particularly important in phlebotomy due to the inherent risk of exposure to blood-borne pathogens like HIV, hepatitis B, and hepatitis C. By consistently implementing these precautions, a barrier is created between healthcare workers and these pathogens, significantly minimizing transmission risk. This universal transmission-based precautions. When standard precautions are insufficient, transmission-based precautions provide an additional layer of protection for patients known or suspected to be infected with highly transmissible pathogens. These extra steps are categorized into three main types: droplet, airborne, and contact precautions. Droplet precautions are used for germs spread through close respiratory or mucous membrane contact via large droplets from coughing, sneezing, talking, or medical procedures. These droplets typically travel 3 to 6 feet and do not remain suspended in the air for long. Infections requiring droplet precautions include influenza, mycoplasma pneumoniae, walking pneumonia, pertussis, whooping cough, rubella, German measles. Airborne precautions are necessary for pathogens so small they remain suspended in the air for long periods and travel longer distances, making them highly contagious. These germs can be inhaled or deposited far from the infected person. Infections requiring airborne precautions include measles, varicella, chickenpox, disseminated zoster, shingles, and tuberculosis, TB. Specific protocols. Meticulous specimen collection is crucial for accurate diagnostic testing. Errors in this stage can compromise patient care. Getting a good blood sample starts with meticulous attention to detail from the very beginning. This involves ensuring the right patient, using the right tools, and keeping the patient comfortable and informed. The integrity of the entire testing process hinges on how well the sample is collected, as errors at this stage can compromise diagnostic accuracy and patient care. For example, a poorly collected sample can lead to hemolysis, making it unsuitable for many tests. The first and most important step is correctly identifying the patient. Hospitals and clinics use strict protocols, typically involving at least 2 forms of identification, such as asking the patient to state their full name and date of birth, and then comparing this information with their ID band or medical record. Mislabeled samples can lead to severe consequences, including misdiagnosis, incorrect treatment, and even patient harm. Studies show that patient misidentification errors contribute to a significant percentage of pre-analytical errors in laboratories. Before approaching the patient, all necessary equipment must be ready and organized. This includes checking collection tubes for expiration dates and damage, selecting the correct needle size with a safety device, and having a clean tourniquet, alcohol swabs, sterile gauze, and bandages. A puncture-proof sharps container must be readily available for safe disposal. This meticulous preparation minimizes interruptions and reduces the risk of contamination, ensuring a smooth and safe procedure. Specimen processing techniques. Immediately after blood collection, proper specimen processing is crucial for maintaining sample integrity and ensuring accurate test results. Mishandling at this stage can lead to erroneous results and inappropriate treatments. The initial steps involve gently mixing the sample, typically by inverting the tube 5 to 10 times to ensure anticoagulation. Special handling needs must be considered, as some tests require immediate cooling in an ice slurry, while others need to be kept at body temperature. For example, arterial blood gases require immediate cooling to prevent metabolic changes. Protecting samples from light is also vital. Substances like bilirubin are light sensitive and can break down. Centrifugation is a common step, separating blood into red blood cells, plasma serum, and the Buffy coat based on density. Correct speed and time, as per standard operating procedures, are essential to avoid cell damage or incomplete separation. Temperature control during centrifugation is also important for analyte stability. Crucially, the centrifuge must biological material shipping regulations. Shipping biological materials is a highly regulated activity due to the serious safety risks involved for handlers, the public, and the environment. Mishandling or improper packaging can lead to safety breaches, making adherence to regulations paramount. In the United States, the Department of Transportation, the first step in compliant shipping is proper classification of biological material based on risk level. Category A infectious substances, like Ebola virus, cause permanent disability or fatal disease and require strict packaging, UN 2814 or UN 2900. Category B, infectious substances such as HIV or hepatitis B, are less dangerous but still require specific packaging, UN 3373. DOT mandates a triple packaging system, a leak-proof primary container, a durable, leak-proof secondary container with absorbent material, and sturdy outer packaging, at least 100 millimeters by 100 millimeters. This system must withstand a drop test without leaking. Proper marking and labeling are vital, including the shipping name, UN number, and biohazard symbol. Shipping papers or dangerous goods declarations provide detailed information. Medical waste classification systems. Medical waste management is a careful system designed to protect healthcare workers, patients, and the environment. It involves proper sorting, classification, risk assessment, and clear labeling. This system ensures that waste is handled and disposed of safely and compliantly, preventing the spread. Medical waste is broadly categorized based on its potential harm. Infectious waste, which could cause infections, includes blood-soaked materials, used blood collection tubes, contaminated PPE, and cultures of infectious agents. This waste typically goes into red bags or biohazard-labeled containers and is treated by autoclaving, incineration, or chemical disinfection before final disposal. Sharps waste, such as used needles, lancets, and broken chemical waste from laboratory tests, includes expired reagents, cleaning solutions, and fixatives. It must be separated by properties, corrosive, flammable, toxic, and stored in compatible, clearly labelled containers. Disposal methods vary, including neutralization or hazardous waste facilities. Pharmaceutical waste comprising unused, expired, or contaminated drugs. Decontamination methods. Decontamination is crucial for eliminating infection threats from biological materials in the lab, involving serious measures with specific rules and best practices. Autoclaving is a powerful sterilization method using high-pressure steam to denature proteins and nucleic acids, killing bacteria, viruses, fungi, and spores. A standard cycle typically involves heating materials to 250 degrees Fahrenheit, 121 degrees Celsius, at 15 psi for 15 to 20 minutes, though time and temperature vary. Proper loading is essential to prevent incomplete sterilization, requiring loose arrangement in autoclave bags to allow good steam circulation. Monitoring with chemical indicators, autoclave tape, and biological indicators, Geobacillus stereothermophilus spores, verifies effectiveness. Regular maintenance, including gasket inspection and calibration, ensures proper functioning. Chemical disinfection uses agents like bleach, 10% solution for surfaces, alcohol, 70% ethanol, isopropanol, quaternary. When using chemical disinfectants, strict adherence to manufacturer instructions for concentration, contact time, and application method is vital. Proper PPE must be worn, and areas should be well ventilated. Thorough cleaning to remove organic matter before disinfection is crucial, as debris can inactivate many disinfectants. Proper disposal of used disinfectants according to local regulations is also necessary. Autoclaving is generally the most reliable for heat-stable items, while chemical sterilization
Well done. Thank you for completing this training.